What we will do is to stop at various points in the case and describe what would be the typical diagnostic and therapeutic dilemmas at these points in time. Since we want this to be interactive, feel free to stop us if you have a question at various points. If not, we'll carry on. So, this is a case which I suppose many of us would be seeing day to day. This is a middle-aged man, no previous medical history, made by his company to go for an executive health checkup. Sedentary job, but works out at a gym when he can. And the only symptom which he said was that he occasionally needs to get up at night to pass urine. Family history, his mother was diabetic on OHAs and his father had suffered from hypertension and ischemic heart disease. Mildly obese, body mass index of around 26, blood pressure 144/90, respiratory rate 16, 1+ spitting edema, and all systemic examination was normal. Nothing in his hemoglobin, urinalysis 1+ albumin, 3+ glucose, and he wasn't a known diabetic at this point. Blood urea 45, creatinine 1.25, total cholesterol 213, LDL 110, ECG chest X-ray normal, 2D echo normal, low vitamin D, well that's done in everybody these days, thyroid and liver function normal, USG normal sized kidneys, and a bladder that voids almost, empties almost to completion. So the questions are, does this patient have renal disease? You have a serum creatinine of 1.25. What do we think of a serum creatinine of 1.25? Is creatinine good enough? Yeah, thanks. Is creatinine good enough? Or yeah. Do we need any other biomarkers to decide about renal function? We know that isotope scans are available, and we also know today that we can get calculators with formulas to calculate GFRs and creatinine clearance. Which one should we use? There are apps which give all 4 of them, all 5, sometimes even up to 10 formulae available. Are they validated for Indian patients, or are they entirely true for American and European populations? I'll ask Vipul to run you through these 4 questions. Vipul.